Have you already registered? If not, then do it quickly.
Welcome, dear viewers, to Today in the natural medicine format. Today's topic is migraines and chronic pain. And if you're one of today's exciting guests, you'll see right after the intro. So stay tuned for more. Welcome back, and a warm welcome, dear Harald.
Hello, Fabian.
Hello, you're a specialist in medicine and of environmental medicine in practice. Yes, today the topic of migraines and chronic pain. What have you got for me? Migraines are something I've never experienced chronically myself, but there have been a few phases that are very severe.
Be happy. Yes, migraines are of course something which is extremely unpleasant. There are people who have migraines, attacks due to stress or whatever, but there are also a lot of people for whom this happens again and again. And in Germany alone, we have 11.8 million women and slightly fewer men, 4.8 million men, who we are aware of. There is a huge number of unreported cases, and the trend is rising. And chronic migraine is of course a disease that really knocks you out of your everyday life. It starts with pain, sometimes with advance notice, sometimes without an aura, depending on what you call it. And then it can sometimes lead to you lying in bed for 2 days, having to darken everything, feeling nauseous and depressed. So that's something that really unpleasant. It affects your everyday life, interferes with your life, and above all, usually comes down on you or comes over you completely unplanned. And that is something, a chronic illness, that puts you in the ranks of other chronic illnesses that are also on the rise. In Germany, we have seen a doubling of allergy sufferers in the last 20 years. We have more and more people, more than twice as many, who have Crohn's disease. This is a chronic inflammatory bowel disease. We have almost 3 times as many people with multiple sclerosis, a disease that causes tingling, numbness, and even death. We also have almost 70% more autoimmune diabetes in the last 12 years, i.e. this type 1 diabetes that affects children. And that shows, and the list could go on forever, that chronic diseases have increased enormously in recent years, in the last 30, 40, 50 years. And that is of course a problem that we have to keep asking ourselves. Why is this happening?
Yes, exactly, that would have been a question. The figures are incredible.
Yes, they are incredible figures. I mean, we have 80 million inhabitants. If you look at it, 16 million of them are chronically affected by migraine, not including the number of unreported cases and the other things they still have, rheumatism and whatever else. That's enormous, and that restricts the quality of life, which of course also has economic consequences. It costs money when people can't go to work and causes huge economic damage. And of course, in medicine, we have to ask where this comes from and develop concepts to get a grip on it. Yes, of course, there are never any patent solutions where you can kill everything with one measure. But there are good solutions if you know what to look for to help people. Yes, and if you ask yourself where this comes from, why are chronic inflammations increasing? Of course, you can say, okay, it's genetic, but genetics don't change in 50 years. If something changes genetically, for us, it takes 10,000 years. So there must be another reason. And then there was always the discussion that we have better diagnostics today. Maybe we just find it more often. But that's unlikely, because these things tend to affect older people, especially when it comes to diagnostics. But we also have more and more younger people, considerably more younger people, who nowadays come with chronic illnesses. And they still have these complaints, diagnosis or not, still have these complaints. And what is now unanimously reported in epigenetics or wherever is that these must be environmental factors. They play the decisive role here. And then of course there's always the question, yes, environmental factors, what are they? Why environmental factors? Where does it come from? We actually live in a beautiful world, not Africa, where it smokes and stinks all day long and something explodes, but in Germany. Or in Switzerland, these environmental factors have increased considerably in the last 50 years. And it starts with the fact that we have more and more chemicals in our homes. We have furniture that emits vapors. Formaldehyde is well known to many. It used to be in chipboard, and it evaporated. Then there was asbestos, which contaminated people. Then we have color fixers in clothing. We're finding more and more young people with tin in their bodies, for example, because they attract the stuff through perspiration. Or flame retardants. Flame retardants prevent the clothes from burning, but these flame retardants are also absorbed by the body. And in the past, they still had antimony dioxide and halogens, which is no longer the case, but there are other toxic substances in them that then enter the body. The skin can absorb them. Stain repellents, for example. Many people buy sofa sets and then have them impregnated at the factory, so that the hollow wine rolls off, or whatever. But if you then lounge on it, in shorts or without a t-shirt, etc., these substances can also into the body. Of course, they are also partly volatile. You can also inhale them. And these are things that we come into contact with. Deodorants. A few years ago, there was this program where people realized that there is a lot of aluminium in deodorants. Aluminium is toxic to the body, can cause breast cancer, can promote Alzheimer's, etc. People put aluminium under their armpits. Nobody expected it, that it would be toxic in any way. In the meantime, we have mostly aluminium-free deodorants. But even a deodorant or perfume contains a variety of substances that are naturally foreign to the body. They didn't exist in this quantity 500,000 years ago in this quantity.
Is that the case now with deodorants, for example? Is it better to use an aluminium-free one? But is it still not good?
Yes, with regard to aluminium, it is of course great if there is no aluminium in it. But of course it's like everything else, like perfume, like cleansing chemicals. It's all chemicals. When I use a cream, yes, I sometimes have patients who have neurodermatitis or some kind of open skin irritation. They put a cream on it and then say yes, but it still hurts and so on. No matter which cream you use, no matter how good it is, it always consists of 10, 15, 20 different substances. If I now go and say, for example, just use coconut oil, that has an anti-inflammatory effect, that has a moisturizing effect. I have a substance. If I use organic coconut oil, nothing happens. I usually use that, yes. But everything that comes from the industry has to be long-lasting. It has to smell good. It has to be easy to spread. It can't be as moisturizing. So I have to put things in there that these properties, so to speak. But these are all foreign substances. And the more foreign substances get into the body, the more they can have a negative impact somewhere. Because every substance can trigger a reaction in your body that we don't know how it will develop in 5, 10, or 15 years. If a substance comes alone, nothing has to happen. But in combination with maybe 20, 30, 100 other things, it can become a problem at some point. Yes, fragrances, perfumes, disinfectants, these are all things like that. Or in housing construction, yes. We have so many substances in residential construction that evaporate, that outgas, regardless of whether they are glazes, whether they are paints. These are all environmental toxins that can make people ill at some point. Or houses are becoming more and more airtight. What happens? Mold can form. And then we have things in our bodies. Then you get an implant. Artificial hips, artificial teeth, or implants made of titanium or glue when you get new fillings. Or plastic fillings. These are all substances that many people clearly tolerate. But if it's too much, it can make you ill. And fluidization, you start smearing fluoride on your children's teeth at an early age so that they don't rot. Or, of course, all the traffic outside, all the car exhaust fumes from industry, exhaust fumes from cars, and so on. Vaccinations, foodstuffs are also modified today, of course. They are irradiated. They are put into tin cans, which can also contain aluminium or something else. They end up in PET bottles, which contain bisphenol A, all these plasticizers. These are all things that flood your body.
It comes to me on all levels, and there are many things I can't have much influence at all. Sure, I can look at what comes onto my body, what comes into my body, but as soon as I'm outside, I have to...
Exactly. We have to breathe, we have to eat and drink. There are things inside you wouldn't believe. Someone recently made me a film about PFAS, about these polyfluorinated substances, and then I thought, well, it's not a big issue. They've probably stirred up some kind of hype again. The next day, I analyzed the eloates of 5 patients, the first 5 who came in, for 24 of these substances, and was shocked because one had 15, one 18, 220, and one even 22 substances, high and very high in the eloate. That's your Teflon pan. That's in your Gore-Tex clothing and so on. These are things where you think, that can't be true. You don't even expect that. But they don't necessarily have to make you ill, but together with other things, they can really make you ill in the long term. That's what we're seeing. more and more people are becoming chronically ill. Then the thyroid gland goes into decline, Hashimoto's, then the pancreas goes into decline, diabetes, and so on. And there's more. Cosmetics, noise pollution, mobile phones, fungicides, herbicides, pesticides, weed killers. These things are everywhere. Even partly on organic food, of course they are lower. But if the organic field is here and the normal field is there and the wind blows, the spraying stuff and so on, you can't prevent that. Or what rains down from above, the paraffin exhaust fumes, whatever, are of course things that we eat at some point. Plasticizers, solvents, and then there's chronic exposure to pathogens. That's another topic that we're also talking about, which isn't really on our radar. These are also increasing environmental factors that put a strain on us. And we have learned in conventional medicine that when patients are ill, they often have an acute infection, which means that there is some kind of pathogen that suddenly makes them ill. But the fact that these pathogens can run quietly under the radar for years is something we often don't have on our radar, and we often don't even look into it. But what we see again and again, I've been doing such analyses for 22 years, I regularly see in chronically ill patients that in addition to toxins, intestinal disorders, dental disorders, they also always have either chronically active, slightly chronically active Lyme disease, toxoplasmosis, cytomegaloviruses, herpes viruses, chlamydia, staphylococcus, whatever. And these are things that permanently trigger an immune system. It's like stepping on your foot 25 times a day, always so lightly. It will hurt, it will be permanently irritated, and it's exactly the same here. These things are traveling through the body. They annoy the immune system. They don't make you so ill that you acutely get a fat thumb or something festers. But the body is under constant strain. It is constantly overloaded, and this will eventually make it ill. And these are things, or parasites, when people are contaminated with metal, when you're contaminated with lead, when you're contaminated with mercury, then the body simply cannot fight off fungi or parasites. And parasites can then cause allergies again. They can disrupt the gut, they can cause a wide range of inflammations, and of course they can also cause neurological diseases. We'll come back to this in a moment and take a look what can happen.
Gladly.
Rickettsia, whatever. And then if you have aluminium in your body, for example, or mercury, that potentiates these things. That can increase Lyme arthritis, so the joint inflammation caused by Borrelia, that can make Borrelia more active. We know, for example, that testosterone and mercury can enormously increase the severity and side effects of Lyme disease. And these are all things that you have to look at so that you know why someone has chronic migraines, why someone has chronic pain, or other things. Because when such pathogen toxins are in the body, they trigger inflammatory stimuli in the immune system. And here's another example, TNF-alpha, which is often elevated in patients. This is just one example of many inflammatory substances that we measure. But that alone can damage your bones, can cause periodontitis, osteoporosis, can damage your immune system, can increase inflammation, can annoy the blood vessels and irritate them permanently. This can lead to arteriosclerosis, heart attacks, strokes, or stress your hormone system. If you constantly have too high a cortisol level, you can also get diabetes, or the mitochondria are switched off. And then no gas is produced, which damages your body. You get tired, you get listless, your immune system in its function is impaired. You can become tired, you can become more depressed. The fatty tissue is also affected by this. This can cause you to put on weight, burn fat less well, and store more fat. The muscle starts to break down. Fibromyalgia pain can occur. Rheumatic pain can occur. It can lead to mucosal damage to the intestinal mucosa, to the bladder mucosa. Then there are people with irritable bladder syndrome. These are all consequences that are often not even recognized, but which we can measure and explain.
It's incredible what can be triggered. The list goes on and on. I guess that the list could be even bigger.
You can do that for all inflammatory substances. You could go on for hours about what exactly happens where. People would probably fall asleep. We don't necessarily want that. But these things don't just a headache, but all sorts of things. And there are people with multiple sclerosis, people with concentration disorders, people with dysfunctions of the filtration system, people with fibromyalgia, and Parkinson's disease. These are all illnesses that we are seeing more and more frequently, but we often can't even categorize them. Unfortunately, it is often the case that when patients go to the doctor with such things, especially with an unclear diagnosis, if you say they have MS, then conventional medicine will give them a certain treatment. But if someone comes in and says, "I'm tired, my mood isn't good," then they're always shoved into the psychological corner if you can't immediately diagnose what they have and clearly assign it to an illness. Then that is treated in some way. But whenever it's unclear, then it becomes critical and difficult. You can diagnose it, but you can also treat it. That's actually the crucial point.
Yes, let's get into the solutions.
Yes, there are always solutions. Or, as a doctor, you always have to make sure you find solutions. You have to think outside the box. I started 22 years ago because I had asthma myself from the age of 3. With all the bells and whistles. Then 22 years ago, I met a guy at a trade fair 22 years ago. He told me that he was healed with frequencies. Aha, frequency healing, okay? What is that? Then he told me that. Sometimes you have people in front of you who you think he's talking crap. Some people think that's weird. They've never heard that before, but it sounds really plausible. Then I realized that there are frequency therapies such as bioresonance that can be used to treat allergies. I then got rid of my allergies. I could ride my bike again in summer. I could drive a convertible. I could hike through fields with my wife. All things that were absolutely impossible before. Then I said I'd ask friends who have a practice if I could use their practice at lunchtime, on Fridays and Wednesdays at lunchtime. I was able to deal with a few cases with those who didn't get on and didn't fit in with their topic. They allowed me to do that. Then I once treated a boy that was the first case. He had tremors for years, tremors for 3 years, trembled all day. He couldn't write anymore. He couldn't do any more sport or anything else. He then went to all kinds of clinics. They did biopsies and so on, but they couldn't find the cause. I treated him and then realized that he had a pathogen load. So I treated him further. That wasn't yet toxopheresis. We did it with other things. Then he said, "Harald." The convulsions had stopped for an hour. Then I knew I had cracked it. Then I continued to treat him, and then it was gone. I followed the boy over the years. I noticed that he lived in my neighborhood. He's now a dad himself. He never had anything again. That's what I did with many patients. Then, a few years ago, I learned about toxopheresis, where we were simply able to set another milestone, because toxopheresis allows you to get things out that were previously completely impossible. So far, we have been able to remove toxic metals quite well if someone came in and had mercury poisoning, or amalgam, or had too much lead, or whatever. For example, I have never seen a patient with rheumatism without lead poisoning. Not until today. But there are patients who come and are even more seriously ill. Toxopheresis is fantastic for them because it's a blood wash where you can remove things from the body using a well-tolerated procedure, simply via filters. I don't even need to give infusions that bind anything, which is great for people who can't tolerate anything. There are these multi-chemical sensitive patients who react to infusions, to supplements, to vitamins, to everything. I can't give them that. The procedure allows me to simply pull out what doesn't belong in the body without having to do anything. You can also treat patients like this.
But of course, the metals that I was able to take out with the chelate therapy have now also given me access to all those environmental toxins I just mentioned. The colors, the paints, the perfume, I don't know what. Is it all going out?
It goes out, and verifiably. We always rinse what's in the filter into bags and then send the bags to the lab. And they tell us that I can check around 550 substances. That is, of course, very, very expensive. That's why we always do about 60. But if the patient says, "I'd like to know, would like to know this, that, and the other." We have patients who come in and say, "We would like to know if we have Agent Orange in our blood, because I was a veteran in Vietnam." Or we have Vietnamese patients who come and say, "I'm not well." And you sometimes find Agent Orange in the bodies of young people. Or women come and say, "I'm not well. I always have a burning sensation in my body." Breast implants. You can prove that they have silicone and things like that. And I can find that out. And I can prove it. I can show it to the patient. I can also prove it to their insurance company. Look, he has this in his body. And that's what causes these complaints. And above all, you can also see in the blood, when I remove these toxins, that the inflammation levels normalize, that the symptoms go away. That's what the patient then reports to me. You can always do this step by step. Prove it, check it. You can also see when people come back, let's say after the second apheresis, and say, wow, I was feeling much better now, but now it's getting worse again. That things are getting worse again. That's because of the color of the eluate. I can measure it in the lab, etc. And that's what I just said. Measure in the lab. So these inflammation values that are conspicuous in people, I can check them at the beginning. I can see very clearly that they always regress and normalize under this kind of therapy. And this has the effect that I can get chronic migraines under control. This is a very rewarding area. We have patients who come in with chronic migraines 3 times a week, and in all the patients I've treated so far, I've either been able to get rid of the chronic migraine completely or reduce it to such an extent that they say, yes, we still have a bit of headache once a month. We don't need to take any more medication. So it's always possible to achieve fantastic and very pleasing things for the doctor. And that is basically our aim, to look at the bigger picture and see if we can take out what is bothering the body, or antibodies. Chronic migraine is also often characterized by the presence of antibodies that simply irritate the nervous system, etc. Sealing the blood-brain barrier, energy production, better blood circulation. These are all things that are important for chronic migraine, for chronic pain, so that the oxygen circulation works. And I can do that with a therapy like this. That is well tolerated.
Yes, brilliant. That sounds really great. I'm a big fan of measuring, proving, checking. You mentioned proof earlier in relation to insurance. Are there health insurance companies that will support you if you have proof that, hey, I really have environmental poisoning here and I feel better afterwards?
Yes, that depends on the diagnosis. We see time and again that private health insurance companies in particular pay for the therapy in full. They pay for the analysis anyway, but also for toxopheresis. But then, when I provide the evidence and every patient receives a detailed letter from me after the first 2 treatments, which always take place 2 or 3 days apart, it always says what we have found, what we have proven, what does that mean, and then the diagnosis. And if that fits, then they pay for it. That's not always the case. Sometimes I have to argue again, but we can see that this is the case in many cases. With the statutory health insurances in Germany, is not like that. Sometimes they have an exception to this rule, as we have already experienced. But as a rule, the therapy is paid for by private health insurers, and as I said, not by everyone. It's always a case-by-case decision. It also depends on the diagnosis. This also depends on what the patient has done before. People usually come to me. People come to me when nothing else works. They've already been God knows where. Then, of course, there's always the pressure for the insurance company to say, okay, if they've already done everything and it doesn't work and it helps, then it has to be reimbursed. But as I said, that's an individual case history. And regardless of that, it is, of course, always a question of quality of life. Of course, it's always nice when everything is paid for, but it's often the case that I have to pay for things myself, but I get my life back afterwards.
Exactly. You don't have to go through all the therapies for years before you actually do it.
I wouldn't want to do it.
Why go up the stairs when there's a lift, right?
Exactly.
Great. Dear Harald, where else can you find more information on this subject? About toxopheresis in general?
Yes, you can go to my website, upburgard.de. It says a lot about it. You can write to us. And of course, you can also get the information. Of course, you can also look at QS24, where we have already made many films about the individual topics. That way you can get information.
Wonderful. The information is there. Great. Thank you for being here.
Yes, thank you very much for the invitation, and all the best for the future.
Thank you very much. I wish you the same.
Stay healthy.
Likewise. Yes, dear audience members, I also wish you the very best of health, lots of prevention, and see you all again.